Reading Comprehension, C1-C2, Lesson 16, Mental Health Awareness and Stigma, Progress and Challenges. Let's begin.
In recent years, awareness of mental health issues has grown significantly. Societies around the world are beginning to acknowledge that mental health is as important as physical health and that mental illnesses deserve the same attention and care as any other medical condition. However, despite the progress made in promoting mental health awareness, the stigma surrounding mental illness continues to be a major barrier to treatment and understanding. Addressing this stigma, along with improving access to mental health services, is essential to ensuring that individuals receive the support they need. Mental health refers to a person's emotional, psychological, and social well-being. It affects how individuals think, feel, and act, as well as how they handle stress, relate to others, and make decisions. Mental health is important at every stage of life, from childhood through adulthood. Yet, for much of history, mental health has been neglected, with mental illnesses often misunderstood or ignored. It is only in recent decades that the medical community and society at large have started to take mental health more seriously, recognizing the prevalence of conditions like depression, anxiety, and bipolar disorder. One of the most significant challenges in addressing mental health is the stigma attached to it. Stigma refers to negative stereotypes and misconceptions about mental illness that can lead to discrimination and exclusion. Individuals suffering from mental health conditions are often viewed as weak, dangerous, or incapable, which can prevent them from seeking help. This stigma is deeply rooted in societal attitudes and is perpetuated by media portrayals that depict people with mental illnesses as violent or unstable. These representations not only reinforce harmful stereotypes but also contribute to fear and misunderstanding. The impact of stigma is profound. Self-stigma, where individuals internalize negative societal attitudes, can lead to feelings of shame, guilt, and hopelessness. People who experience self-stigma may feel unworthy of help or believe that they should be able to snap out of their condition. As a result, they may delay seeking treatment or avoid it altogether. This is especially problematic since early intervention is often key to effective treatment. The longer mental health issues go untreated, the more severe they can become, potentially leading to complications like substance abuse, social isolation, or even suicide. In addition to self-stigma, structural stigma exists within healthcare systems, workplaces, and governments. Mental health services are often underfunded, and mental illnesses may not be treated with the same level of urgency as physical conditions. For example, in many countries, insurance coverage for mental health treatment is limited, making it difficult for people to access the care they need. In the workplace, employees may be reluctant to disclose a mental health condition for fear of losing their job or facing discrimination. This can create an environment where people feel pressured to hide their struggles, rather than seeking help and accommodation. Fortunately, efforts to raise mental health awareness are gaining momentum. Campaigns like World Mental Health Day, observed on October 10 each year, aim to promote understanding of mental health issues and reduce stigma. Public figures and celebrities speaking openly about their own mental health challenges have also helped to normalize the conversation. When high-profile individuals share their experiences with depression, anxiety, or other conditions, it sends a message that mental health struggles are common and not something to be ashamed of. This visibility encourages others to seek help and reduces the isolation that many people with mental illness feel. Education plays a critical role in reducing stigma and promoting mental health awareness. Schools, workplaces, and communities are increasingly implementing mental health programs that teach people about common mental health conditions, how to recognize signs of distress, and where to find help. These programs emphasize the importance of early intervention and provide tools to manage stress, improve resilience, and support others who may be struggling. By fostering open conversations about mental health, these initiatives aim to create a more supportive environment where people feel comfortable seeking help. Despite these positive steps, there are still many barriers to achieving widespread mental health awareness. One major issue is the cultural differences in how mental health is understood and addressed. In some cultures, mental illness is still seen as a taboo subject, and discussing mental health may be discouraged or even stigmatized further. In other cases, mental health problems are not recognized as medical issues but are attributed to spiritual or moral failings. Overcoming these cultural barriers requires tailored approaches that respect cultural beliefs while also promoting the importance of mental health care. The global disparity in access to mental health services is another critical issue. In many low- and middle-income countries, mental health services are scarce or non-existent. Even in high-income countries, there can be significant gaps in access, particularly in rural or underserved areas. Mental health professionals are often in short supply, and waiting lists for treatment can be long. Telehealth services have emerged as a potential solution, allowing people to access therapy and support remotely. However, digital health services are not universally accessible, particularly in regions with poor internet infrastructure. Ultimately, breaking the cycle of stigma and improving mental health outcomes requires a multifaceted approach. Governments must prioritize mental health in their healthcare policies, ensuring that services are adequately funded and accessible to all. The media must portray mental illness in a more nuanced and accurate way, avoiding sensationalism and stereotypes. Communities must foster environments where mental health is openly discussed, and individuals are encouraged to seek help without fear of judgment. And, most importantly, individuals must continue to challenge their own assumptions and biases about mental illness, recognizing that mental health struggles are a normal part of the human experience.
Thanks for watching. Visit www.tutorukabc.com for more fun learning material.